It all ended up going incredibly smoothly. We had pretty much no interruptions to normal operations. The first day that we transitioned into Prompt, you wouldn't even know that we had just made this huge lift and changed our number one system that we use on a day-to-day basis. My name is Marissa Bingler. I'm Vice President of Clinical Services at JAG Physical Therapy. I oversee our offices in our New Jersey region, and I manage all of the employees and its patients. Some of the red flags that we were noticing in our previous EMR system was that we felt that they were losing touch with their customer service skills a little bit. We're a growing company. That means that we have evolving needs. We have different specialties. We are in 3 states. We have a lot of clinicians, and we need to be able to support the operations and our employees and our patients. The biggest priority to us got to the point where we realized that our patient collections and our revenue was being affected by the lack of responsiveness in our requests as a growing company. What stuck out about Prompt to us was their willingness, the team's willingness to tailor the system to match JAG's needs. The size of JAG, being 170 offices now, definitely presents challenges in relying on one system to oversee the operations. And Prompt was able to hear all of our needs and our requests, and they were able to match those in order to bring it all within the system, to be able to organize it and be able to create a good flow for us and our employees. Some of the immediate changes that we saw since we switched over to Prompt was revenue collections. We've seen an increase in revenue per visit since making the switch. We saw a very short-term increase in addition to time to submission of claims. And those are incredibly important to us from the start, making such a big transition into a brand new EMR system. And they both ended up doing well in the first few weeks. Gets the claims out quicker, which means that we can get the payment quicker. There's not a delay or a lag in receiving payment for the services that we're providing. We're about 80 to 85% arrived capacity. We schedule typically up to 100% of our schedule capacity, which again is another great metric to have and to kind of be able to forecast where we're going to finish the week in terms of visits. But yeah, our schedule capacity has tremendously increased because of the automated patient engagement. Since switching to Prompt, the feedback that we've gotten from the field has been incredibly positive. They say that to get their notes done has been so much faster. We've even noticed it in our metrics of days to finalization. The automated patient engagement features on Prompt, it's taken a workload off of them. We are incredibly grateful to Prompt for designing this system that has ultimately bettered our employee experience, that has allowed us to operate and run a company of our size efficiently and successfully, and at the end of the day gives us the ability to provide the best patient care for the people in our community.